Good afternoon. My name is Jason Willis-Lee. I studied medicine and physiology for 4 years at Bristol Medical School from 93 to 97. I then went very quickly into applied linguistics, and I did a postgraduate diploma in translation from the University of Bath. And I then very quickly came out to Spain because I only had French at that time, and I wanted to add another source language. And I've been full-time self-employed, I think, since 2005. And I had another sort of part-time thing going for another 5 years before that. So I've done a few of the rounds, and most of my work is split into clinical trials, medical reports, and I would say research articles, academic publications. That's a sort of 1/3 each. So these are just some courses I give for colleagues, which I hope are useful. I hope you find this useful. Please tell me if you do. If you don't, please tell me why, what you'd like to see. So that's me, and those are my contact details. You can find me at those hashtags and websites. So the ECG is obviously a graphical presentation of the heart's activity. The US spelling is EKG. There's a K instead of the C, so there's a UK-US difference there. And when we talk about the ECG, we talk about rhythm, we talk about rate, the axis of the heart is important in cases of hypertrophy of the ventricles, and then the waves and the intervals. And the intervals are usually the PQ, sometimes called the PR interval, the QRS complex, which is a combination of 3 waveforms, the Q, R, and S. The Q is negative, the R is positive, and the S is negative. So that should really be lowercase q, uppercase R, small case s. That's the annotation. The QT interval, and finally the ST segment gives us information on whether the blood supply is going to the muscle properly, cases of ischemia, infarction. So I'll basically, as Carolina said, I will give you some knowledge check questions to consolidate the material we're covering, and if you could answer those in the answer panel, that would be great. They're very easy questions, and they come soon after I cover the material. And then I'll give you some useful links and take some questions if you